Today we'll be talking about breast. We'll cover breast in a series of lectures. This is the first one. We'll discuss the basics, that is the surgical anatomy and the basics of investigations that are done in case of breast lesions. For the material that is used, I've completely used Bailey and Love's Short Practice of Surgery's 27th edition. I haven't referred to any other source. And if you're using the same source, it will be easier for you to revise. I'll introduce myself. I am Trushdeep Agrawal. I'm currently an MBBS intern at a government medical college in Maharashtra. I am also college student of European School of Oncology. I am also a global burden of disease collaborator under the Institute for Health Metrics and Evaluation. So, starting with the surgical anatomy. In surgical anatomy, the first thing that we need to know is the extent of breast. Where does the breast lie? So, the breast lies around the second to the sixth nipple and it lies from the lateral border of the sternum to the anterior axillary line. A thin layer of mammary tissue might extend from clavicle to seventh or eighth rib. This is important to know because when a mastectomy is done, we need to remove all of the breast tissue, and this information comes handy in that cases. Axillary tail or the axillary tail of Spence. This is a palpable mass that is felt in the axilla. It might sometimes even be visible, and a well-developed axillary tail can be mistaken for a large mass of lymph nodes or for lymphoma. Lobules and lactiferous ducts. Lobules are the structural unit of breast. Around 10 to 100 lobules come together and empty into a lactiferous ducts, which in turn are in 15 to 20 in number. And lactiferous ducts are lined by spiral arrangement of contractile myoepithelial cells. And these lactiferous ducts later terminate into an ampulla, and from there the milk is expressed via the nipple. So here's an image for visualizing. You can see the lobules, then there are ducts, and then there's nipple. Ligaments of Cooper. Ligaments of Cooper are hollow conical projections of fibrous tissue. These attach to the superficial fascia and the skin overlying the breast. When a tumor is formed, which involves the ligaments of Cooper, the tumor pulls the ligaments and hence it pulls the overlying skin of the breast, and this leads to puckering of skin or dimpling of skin, which is a common sign seen in case of malignancies of breast. Areola. Areola is the tissue that surrounds the nipple and contains of involuntary muscles which are arranged in concentric rings and radially, and it has both sweat and sebaceous glands. Important thing to note here is these sebaceous glands enlarge during pregnancy to lubricate the nipple during lactation. These during the period of lactation are called Montgomery's tubercles. Nipple. Nipple is a erectile structure that points outwards. It is covered by thick skin with corrugations. The apex of the nipple has orifices or openings of lactiferous ducts, and smooth muscles present in nipple are arranged concentrically and longitudinally. Lymphatics. This is important when it comes to malignancy, as well as this is important for your clinical examination. You need to examine the axillary lymph nodes. It is a important part of your breast examination viva as well. So 85% of the lymphatic drainage is primarily done in the axillary lymph nodes. The these are lateral, anterior, posterior, central, interpectoral, and apical. And other than that, there are also internal mammary lymph nodes. Investigations. So investigations, this topic is a very important topic both for your viva and for your theory examination. So the first thing that is to be noted here in case of breast is triple assessment. What is triple assessment? Triple assessment is assessment using these three. clinical examination alongside history, radiological examination, and histopathological examination. Triple investigation has a positive predictive value of 99.9%. Hence, it is advised to do triple investigation in cases when you suspect the lump to be a malignancy, or if you even consider it to be benign, but you still feel a lump. It's best to do triple assessment. So, for clinical examination, I would highly suggest you to go through Dr. Ghanshyam Vaidya's clinical cassette. These videos are present on YouTube. You can go through it. There, he has explained everything very well, along with he has performed examination on real patients. You can refer to those videos. Moving on to radiological examination. These are some of the common modalities which are done. The first one is mammography. Then there's tomosynthesis, USG, and MRI. Mammography is done when the patient is older than 40 years so that there isn't much glandular tissue that obscures your view, and the microcalcifications don't hide in case the breast tissue is higher. In younger population, USG is preferred because you can visualize better and differentiate better between glandular tissue and calcifications so that you're able to recognize any lesion. Then histopathological examination, there's needle biopsy or cytology. An example of this would be the most commonly known investigation modality in case of breast, that is fine needle aspiration cytology. Here we use a 21 or a 23 gauge needle, and then there's large needle biopsy with vacuum systems. We use a 8 gauge or 11 gauge needle. We'll discuss the investigations further in detail in the next video. Thank you guys.